Something I just thought of, and that it's a habit of a lot of people. People crack their neck back and forth.
Right.
Is that like the cracks that we hear? Is that something that is like with what you're talking about, or is that completely like different from the area that you're adjusting for people?
Yeah, that's different. So a
Oh,
lot of people think that the popping and the cracking and things like that is bone on bone clicking. Actually, what that is our joints are their synovial joints, our vertebra. And synovium is a fluid that's in between there, and it contains gases. So if the joints aren't moving properly for an extended period of time, kind of gas bubbles, mainly made of nitrogen, are inside, like little gas bubbles are inside that synovial fluid. And so when you pop your neck, you actually hear that pop, and that's those bubbles popping. I know it sounds really weird.
wow.
But
So
it's not what I feel
okay.
that. But the one thing I want to warn people about is when you do that, you're actually, you're forcing it. And this is different from a chiropractic adjustment because you're relaxed and the chiropractor has a specific line of drive that they're doing in order to perform that adjustment, but you're really pushing it and torquing it. And what you're doing is you're elongating those ligaments that hold your bones in check, basically ligaments that they hold bone to bone. So when you do that, you're lengthening them. So what happens is over time, those ligaments start to get longer and longer, and they get more flimsy and loosey goosey, and then it can't hold your neck, your neck muscles. I mean your neck bones, your vertebra, in proper alignment. So you're going to do it more and more, and you're going to find that things are moving too much. You are going to find that it's just like you can't stop doing it. And part of it too is when you hear that pop, they call it cavitation, you're actually releasing endorphins. And those are opioids that your body makes. So you're kind of addicted to the drug. I would say you're addicted to the crack. So,
And like that's funny, yeah. That's and like I always hear, don't pop your neck or don't pop your back, all these things, but it makes so much sense whenever I hear it from you who just explain why you actually probably shouldn't be doing that, opposed to like my grandma. It's like, oh no, that's bad for you, but she doesn't explain it and she doesn't tell. So thank you. It has nothing to do with anything, but just something that I was curious about.
no, that's actually a common question I get. So yeah, very, very common question.
In your opinion, what are the most common like problems that people come in besides migraines for like your clientele specifically that see like instant improvement as soon as you adjust them?
I would say probably the most common is neck pain.
Okay.
Especially with the way, what do we do all day? We're on our computers,
Right.
right? We're on our phones like all
Yeah.
the time. So that we have this head forward posture, and that puts a lot of stress on our neck. I mean, by the end of the day, our necks are all craned to our computers, and then we go home. What do? We stare at our phones all day. So we have this chronic problem right now, this forward head posture. And what happens is over time that causes a lot of stress and strain, not only on those muscles, but it can cause problems as far as degenerative changes. It starts creating arthritic change in your neck. So I would say probably, right after the atlas alignment, especially that first one, when they get that atlas alignment, I actually do before and after. So I'll feel their neck, and there's what we call a C2 nodule that forms right there. It's one of the indicators. There's an atlas misalignment. We have three different indicators. One is that short leg, another is a high hip, and the other one is, we'll find like it kind of feels like a grape in the neck, and you can press it. And many times patients will go, yeah, I have that. It's like my little pet. It never goes away. I constantly rub it, but it never goes away. And so what I do is I feel that part of the neck before the alignment, and then once I get them right up and I feel that area and it's gone. It's like melted away. It's like the neck turns into marshmallows. So they're like, whoa, that's really weird. So that's something that I love. I love seeing the changes, the before and after, because I tell them what's going to happen.
Right.
And they're like, really? And I go, yeah, that if we got a good alignment, these are the checks and balances that we have to make. We want to make sure we see the neurological changes, before and after. So you can not only see it, but you can feel it. And we know we got a good alignment.